With the COVID-19 pandemic second wave hitting us really hard, this is the time for us to reflect on what have we learned from the first wave. Some facts are crystal clear. Those patients who have got comorbidities like diabetes, high blood pressure or hypertension or obesity are much more likely to develop severe COVID-19 infection. There is a high chance that they would be admitted to the hospital and likely to go on ventilator or unfortunately die. The Center for Disease Prevention and Control, the CDC, has given us some data which clearly shows that over 94% of those who were hospitalized with COVID-19 infection from March 1st to March 30th in 2020 have had at least one comorbidity. So what is this data telling us actually? The fact that COVID-19 severe infection is much more common in these patients who have got comorbidities. We need to understand the science behind it. Why is it happening? So if you look at all these health conditions or comorbidities, there is something common between all of them. The first thing is they're all state of chronic inflammation, which is happening constantly over a longer period of time. Number second is impaired immune system or low defense mechanism. And number three is the fact that the blood is more likely or more prone to get blood clotted. This is how it makes it easy for COVID-19 infection to give higher level of complications or more severe infection. Let's look at the diabetes scenario. Often my patients ask me, are there any special precautions I need to take being a diabetic? Now there are few things you must keep in mind if you're a diabetic. The first thing is taking your medications as prescribed, may it be tablets or insulin, and making sure that they are well stocked, especially if the lockdown is coming again. You don't want to run out of your medicines. Again, having plenty of testing strips, especially if you're type 1 diabetic, and having ketone strips in case of high sugars or an emergency to double check is quite important. Have a hypoglycemia kit handy in case your sugar levels drop below 70 mg per deciliter, and make sure that you've got a diary with important contacts of your family, neighbors, or your doctor's number or somebody who you can rely on in case of emergency. So what about people who have got high blood pressure or hypertension? As much as it's important to make sure your blood sugars are monitored, it's equally important to get the blood pressure monitored at home. If you've got a physician, make sure you have some contact or regular visits to get your blood pressure under control, because again, uncontrolled high blood pressure has been linked to severe complications due to COVID-19 infection. It's very important to have a cardiology review at least once a year, because remember, high blood pressure does not give you much symptoms, but it is a major risk factor for things like heart problems, stroke or paralysis attack, and other kidney complications as well. So make sure your blood pressure is under control and you've seen a cardiologist at least once a year. So with so much of negativity going around, rising numbers, anxiety, panic situation, and real depressing atmosphere, is there a good news? Well, certainly there is a ray of hope here. We all can play our part and make sure that we actually prevent certain things escalating to this level. So the top priority should be your nutrition. Remember, you are what you eat, and it's very easy to indulge into something deep fried or fatty or junk food or a packet of crisp that comes on your way, especially if you're working from home and working long hours, if you're stressed and overloaded with loads of things. But it's quite important, especially if you've got comorbidities, to make sure that you're eating nutritious and healthy food, because you really don't want to put on that extra weight. Low salt diet is quite important, especially if you've got high blood pressure. And make sure you get a lot of vegetables and fresh fruit, and choose good snacks like dry fruits or peanuts, or even make some interesting chaat dishes for yourself to keep going throughout the day. Choose an exercise regime which is enjoyable and sustainable for you in a longer term. It could be as simple as walking, running, cycling, or treadmill at home, or even something like yoga, Zumba, or dancing, anything that you enjoy. Remember, you would never regret a workout. It's always a good idea to drag yourself if you're not feeling up to it, because there is always that good feeling because of endorphins later. And we also know the fact that exercise is a therapeutic option for depression or anxiety or any mental health issues. Last but not the least is your own mental health. Now we know that people who have got diabetes, high blood pressure or obesity are more prone to get anxiety and depression. Make sure that you've got good friends or family or someone you can actually share and talk your worries or concerns. If you need any professional help, speaking to a psychologist can always help. Like I mentioned earlier, exercise is a good way to help depression or fight anxiety as well. Concentrate on things like breathing exercises or meditation or yoga to help yourself. There is so much available on internet as to how you can help yourself if you're suffering from panic attacks, for example. Remember, mental and physical health are quite interlinked. And to a lot of extent, your physical and mental health are in your own hands. And in spite of having these comorbidities, you are able to prevent COVID-19 related complications, just making sure that your mental health is taken care of and also you do your bit from physical health point of view. Thank you.